Have you ever felt like when it comes to big, important conversations, we're kind of missing a big piece of the puzzle? Well, today, we're tackling one of those missing pieces head on as we dive into the challenges faced by Black families when it comes to autism.
And it's such an important discussion to have because early intervention can be so impactful for children with autism. And yet, Black children often face significant delays in getting
Yeah,
diagnosed.
we're going deep on those reasons today, right?
Yeah.
We're doing it with some help from cheapaba. Their website, by the way, they're dedicated to making autism information accessible.
Right.
And they have this super insightful article on the disparities that Black families specifically encounter. And honestly, it is eye-opening. Like right off the bat, they hit you with this statistic. Black children diagnosed with autism an average of 3 years later than their white counterparts. 3 years. That's a huge gap. What does that even mean for a developing child?
Those first few years are really when early intervention can make the biggest difference. It's all about, building those foundational skills.
Hmm.
Communication, social skills, even behavior. We're talking about setting these kids up for success in life. And, a 3-year delay, that's a significant chunk of time.
Especially when you think about the fact that the article talks about how effective early intervention can actually be. It can help these kids learn how to regulate their behavior, deal with things like hyperactivity, and even just navigate social situations. A 3-year delay in that.
Yeah.
It's a big deal. So then what's at the root of this delay? Is it just a matter of awareness?
Well, it's interesting. It's not necessarily a lack of awareness on the part of Black parents. They actually often notice these developmental differences in their kids just as early as other parents. But there's this deep-seated mistrust, right, of the healthcare system within many Black communities. And it's completely understandable when you consider the historical and current inequities.
And it's heartbreaking when you think about it. The article brings up this really jarring statistic that Black women are twice as likely to die from pregnancy complications. So I can't help but wonder if that kind of disparity in care in such a vulnerable time leads to this distrust that carries over to other areas of healthcare, like seeking an autism diagnosis for their child.
Absolutely. It makes you wonder how that influences those interactions later on, right? Because those experiences can absolutely have a lasting impact, make parents hesitant to bring up those concerns, especially if they fear that their concerns are going to be dismissed.
And sadly, that feeling of being dismissed or unheard is a recurring theme, right, in the experiences of many Black families trying to get an autism diagnosis for their kids.
Yeah.
There's actually a psychologist specializing in autism, Dr. Wilkes, and he's quoted in the article talking about how many of these families feel a sense of shame or hopelessness when they try to seek help. They're worried that even if they speak up, no one's really listening.
It's disheartening because it really highlights just how deep those systemic barriers run. It's more than just awareness. It's about truly understanding the experiences of these families.
And it's more than just feeling heard, right? It's about families having to navigate a system that often feels designed to be difficult in the first place. Like the article even talks about how overwhelming the evaluation process alone can be for families, especially when, pediatricians sometimes take this wait and see approach instead of just really addressing those concerns head on.
And that wait and see can be so damaging. We've talked about how crucial those early years are for intervention, and, waiting just makes it that much harder for kids to catch up. And honestly, even beyond the waiting, the evaluation tools themselves might not be doing Black children justice. The article, it points out that a lot of these tools we use to evaluate kids for autism, they're based on research that was primarily done on white middle-class children.
So you're saying the very tools we're using to diagnose autism might be missing the mark when it comes to Black children because they weren't developed with a diverse population in mind.
Yeah, and unfortunately, like the article highlights, it means Black families often have to go through multiple evaluations before getting a diagnosis.
Oh, wow.
And that's emotionally draining. It's financially burdensome, especially for families who are already dealing with a system that can feel stacked against them.
It's like hurdle after hurdle.
Right.
And then on top of those systemic barriers, there's also just the stigma surrounding autism in general. And I feel like for Black families, the article talks about this, it often means facing judgment, even within their own communities, like a fear that a diagnosis is somehow a reflection of them as parents.
Right, absolutely. That weight of the stigma in some communities, it's real. And that fear of judgment can really prevent families from getting the help that they need when they need it most. And it's like, that's where breaking down those stigmas becomes so crucial, both within the Black community and just society as a whole.
It's about fostering understanding and acceptance, not just within the healthcare system, but also
Yep.
just within communities themselves.
Exactly. And the good news is The article does offer some hope here. It really stresses that knowledge is power, especially for parents who are trying to navigate this whole journey.
Knowledge is power, for
Yeah.
sure. But where can these parents even begin to tap into that? Like, what kind of knowledge are we even talking about here?
Well, the article really stresses that parents, they need to understand those early signs of autism, right? So they can be the best advocates for their kids. And just as important, they need to know their rights. Like they actually have the right to request those evaluations for their children.
Even if their pediatrician is like, oh, let's wait and see.
Exactly. It's about empowering parents to really step into that advocate role.
That's huge. But I imagine it could feel really overwhelming, especially when you're already dealing with a system that can feel kind of impossible to navigate. So are there like specific resources out there that are designed to help Black families with all of this?
Absolutely. In fact, the article mentions a couple of great ones. There's The Color of Autism and Autism in Black, and they offer amazing support and information specifically for Black families facing autism.
Oh, that's fantastic.
Yeah, they really cover it all, from education to support groups, even connecting families with professionals who get the unique challenges they're going through.
So it's like finding those lifelines, those people and organizations that can actually provide guidance and support, tailored to what they're going through. That's so
Mhm.
important. But it can't just be on the families to figure all of this out,
Right.
right? What about the healthcare system itself? What needs to change there to even begin to address this disparity?
Well, the good news is that there is a growing awareness of implicit bias in healthcare. And the article, it actually points to some positive changes that are starting to happen because of it. Like organizations, like the American Medical Association, they're working to address this through training and education programs
Oh, okay.
to help healthcare providers recognize and address their own biases, which is huge.
Yeah.
And it's not just limited to professional organizations either. Medical schools are also starting to diversify their curricula to better prepare future doctors to serve diverse communities. It's all about creating a system where all families, regardless of their background, feel seen, heard, and respected.
It's about recognizing and valuing the diversity of the families they serve. That's what real equity in healthcare looks like.
Mm.
This deep dive has been a lot, honestly, like from those really disheartening realities of these systemic barriers to the hope that comes from seeing individuals and organizations fighting for change.
I agree. It's definitely complex, but the conversation is happening. The awareness is growing. And that's how we move towards a better future for everyone.
Absolutely. And for anyone listening who's maybe going through this themselves right now, just remember, you are not alone, and you have every right to advocate for your child and to demand the best possible care.
And don't be afraid to reach out to those amazing resources that we talked about. The Color of Autism, Autism in Black, they're there to support you every step of the way.
This deep dive focused on disparities in diagnosis and care for Black children with autism. And it's such an important reminder that while autism affects people from all walks of life, access to the support and care that's out there is not always equal. So as we all continue to learn more about autism, it's crucial that we work to address these disparities and strive for a future where every single family has the tools and support they need to help their kids thrive.